Important question, and this is a self-reflective question. Why does your health matter? Because I submit to you that we can build the best hospital in the world. We can have the best healthcare workers in the world. But if your health does not matter to you as an individual, we will still be challenged. We're going to look at our national statistics because oftentimes when we have these health discussions, we talk about statistics from the US, from Canada, from the UK. And although that's good, it doesn't paint our local narrative because our narrative reveals that we are in the midst of a silent pandemic again. We're going to look at this pandemic and go over some simple health tips, and then I'm going to leave a charge with the executive team of this great ministry. So why does your health matter? This is a self-reflective question. We can say something that is profound and true, that the health of the nation is the wealth of the nation, but in reality, that's nothing more than a cliche for many of us. Why does your health matter? We are a Christian nation. We are a Bible-toting set of people. And the word of God tells us that, beloved, I wish above all things that thou mayest prosper and be in health, even as thou soul prospers. What does that mean? It means that your health is important to God. How can you live your God-given purpose if you're confined to a hospital bed at PMH? How can you be all that you can be if you're sick? That's something to think about, right? How can you be the best husband, wife, brother, or sister when you're always sick, in and out of the hospital? Why else is your health important? Your health is important because you matter. You matter to your families, to your communities, to your loved ones, to the people who are depending upon you. There is an inherent value that is on the inside of you. And I may not like you, but don't let me take that value that is on the inside of you away from you. Your health is important. If you are not here today, that birthday celebration ain't gonna be the same. That anniversary ain't gonna have the same vibe. Christmas didn't have the same vibe for us this year because we buried our aunt. She died December 29th. So Christmas didn't have the same vibe for us this year. There are people who are going to miss you when you are not here. We got to change our mindset and our mentality in this country because too many of us just want to survive. We want to move away from surviving because many people surviving. Many people living long, but they sick. Many people living long, but they can't enjoy their life. Imagine you're 45, massive stroke, confined to bed. You got to move in with one of your children because now your children have to become your primary caretaker. That puts a strain on that child's God forbid this child is still relatively young, 20s or 30s. They got to put their dreams on hold to take care of you because you didn't value your health. And while they being the best caretaker they could be, they slided into depression because caretakers' depression is real. And while they fallen into depression, their marriage falling apart. And no matter how much children you have, the burden typically falls on one girl. We're going to look at some national health statistics because our national health statistics reveal that we are in a pandemic of non-communicable diseases. Don't put your hand up, but I know this room full of people who taking medication for hypertension and diabetes. Don't put your hands up. We're going to look at these statistics. In 2014 and 2019, we're going to look at the 5 leading causes of death in the Bahamas. And I know this is a bit far, right? But the leading cause of death is ischemic heart disease. So we're going to make that a little simple by just saying heart disease. The second is hypertensive disease. Third, stroke. Fourth, violence. Violence is a public health problem. Fifth, breast cancer. Play this game with me in your mind. Let's pretend that breast cancer is no longer on that list. What do these 4 things have in common? They are all preventable. The things that are killing us as Bahamians are preventable. Heart disease, preventable. Hypertension, preventable. Stroke, preventable. Violence, yes, preventable. Anger management, conflict resolution, know your company, know your children's company, preventable. This is where we get real now, because we embarked on a STEP survey to get a nice picture of where we are as a country health-wise. In 2019, we found that the average Bahamian consumes 64 pounds of sugar each year. 64. Let's play a reality game. That's a 5-gallon jug of aqua pure water and then some more. Quick maths. This is the 3rd month of the year, right? 64 divided by 12 is 5.33. That means we walking around with basically 16 pounds of sugar in our system at the end of March. This is 16 health problems related to that high sugar intake. Increased uric acid, tiredness. You're drinking Coke soda because you want the burst of energy, but that can backfire on you. A lot of men don't smile. You know why they don't smile? You could just look at the screen. Clogged arteries. We going back to the very thing that is the leading cause of death in this country, heart disease. This is what sugar is doing. And then we get to my favorite, weight gain. You want to know why weight gain is my favorite? Because 71% of us is overweight. And we see this trickling down to our children because our children are wider. Pass by the schools and you'll see it. We think this is cute, but this is a serious health problem. Look at the first thing my guy is holding in his hand. Heart disease, the #1 cause of death. Look at the second thing, hypertension, diabetes. We're going to come back to diabetes. Hyperlipidemia, cholesterols are out of whack. You know what osteoarthritis is? Your bones telling your body, your weight is too much for me to hold up. And my God, if your bones saying that, what you think but little me? Obstructive sleep apnea. The fat builds up in this neck area. And we understand anatomically this is our windpipe area. When that fat builds, the pressure constricts and can force close your windpipe. Understand that this is serious. This is serious. Other diseases are located below the belt. Do you know why that is? Because for women, when you are overweight, that's fertility challenges. For men, that's sexual dysfunction. 47% of us have high blood pressure. 47. That's vision loss, stroke. Stroke is when a part of your brain dies. So for instance, different portions of your brain controls different things. There's a part of your brain called the Broca's area. If that is affected, that's speech. Broca's area has responsibility for speech. Heart attack, heart failure, right back to the leading cause of death. Kidney disease. Remember the news recently? Challenges at the dialysis unit. Sexual dysfunction. There was a time when I was younger and I would see an amputee. I automatically assumed it was from a motorcycle accident. But because I am more Bahamianized in the healthcare system now, when I see an amputee, I automatically think diabetes. It's sad. Heart attack, blindness, strokes, kidney failure. There was a point when we allocated nearly $25 million to the dialysis center. That number has increased and continues to increase because we eat ourselves into a position that financially we are not able to take care of ourselves, so we are dependent on the state. 7 out of every 10 deaths in this country is attributed to a non-communicable disease. Pressure, sugar, cancers. And that's what we're going to hit next. In 2022, there were 955 new cases of cancer in this country. Everyone in here knows someone who has been affected by cancer. That's the reality of our country right now. 1 in 500 Bahamians are diagnosed with cancer in 2019. The persons who died from cancer in 2022, that number stood at 552. And it was kind of even between the genders. Let's get specific with cancers. Cervical cancer. A lot of times when we talk about cervical cancer, the men become tone deaf because they think this don't apply to them. Please understand the science and the pathology of this. Cervical cancer is the second most common cancer among Bahamian women. Every year, 39 women are diagnosed and 28 die from the disease. 39 are diagnosed, 28 die. Being vaccinated, and I know y'all don't like vaccines, because we could see the numbers with your children, but being vaccinated with the HPV vaccine can protect against the HPV strains that cause up to 90% of all cervical cancer cases. What does that medical jargon mean? If you take the HPV vaccine, we can reduce your risk of cervical cancer by up to 90%, which means we can effectively eliminate cervical cancer. I can tell you from experience, as a healthcare provider and as a man, if there is one particular cancer I hate, it's that. Oftentimes, it is always diagnosed late when really nothing can be done other than trying to keep someone comfortable. Men, here's why this is important for you. You don't get cervical cancer, but you can transmit the virus that can cause cervical cancer. So this is why vaccination for you is important. So when you are vaccinated, you help reduce the risk of spreading the human papillomavirus. When men are vaccinated, you reduce your risk of penile cancer. Think about this. Please think about it. Because sometimes you say, this don't apply to me until life gets real and be sitting in the office in the hospital. Prevention is better than cure. And we ain't curing much right now. The second most commonly diagnosed cancer in the country. And this one hits home for me, because this is what my aunt died from. She was diagnosed at stage 2 to 3, and it rapidly spread from one breast to both lungs, to the brain, to the kidney, to the bones, to the liver, to the pancreas. Please hear me. We have the highest known frequency of the BRCA gene mutation. The BRCA gene in and of itself is a good thing. The BRCA gene suppresses tumors. The mutation of the gene is the problem. We have the highest frequency in the world of this gene mutation. 25% of all of our breast cancer patients have this gene mutation. We are diagnosing some 300 to 500 women every year with breast cancer. 300 to 500 every year. And nearly half are not 50. Why is that 50 age so important? That age 50 is important because the average age of diagnosis in the US is 62. Our average age of diagnosis is 42. So we are being diagnosed way younger. And our disease progression is very rapid. Nearly half of all of our women who are diagnosed at stage 3. Stage 3 breast cancer, meaning that the cancer is no longer localized to that initial spot where it was. It means that it's invasive, it's moving, it's spreading, it's going to the lymph nodes, it's going to the muscles, to the chest wall. The more advanced the cancer becomes, the lower the prognosis goes. And please hear me. I'm not trying to be insensitive to anyone who is going through a battle. Continue fighting, continue to be strong. 43% of the women who die from breast cancer are under the age of 50. My aunt died at age 46, and she had a 4-year fight. Understand where we are. To the men, you have the #1 cancer in the country. Let me back up for you for a second. One thing on breast cancer. Breast cancer must move from a fashion statement into real life screening. October is Breast Cancer Awareness Month. It's cute to wear your pink shirt, but please go get your mammogram. Don't wear your pink shirt and don't get your mammogram. That makes no sense. People who are being diagnosed oftentimes aren't getting mammograms done. So please, be serious, take this seriously. And just so that we know, men, that there are men in this country who are being diagnosed with breast cancer as well. 1 to 2% of all breast cancer cases globally are men. I know 3 men in this country right now with breast cancer. Please take your health serious. Now, prostate cancer. This is the #1 cancer in the country. 1 in 8 Bahamian women will be diagnosed with breast cancer in their lifetime. 1 in 6 Bahamian men will be diagnosed with prostate cancer. These are our statistics. These are our realities. What does that mean for us? We have to take simple health tips and put them into practice. So let's move quickly. We want to reduce or eliminate red meat and processed foods from our diet. I'm going to double back to tell you why we want to reduce or eliminate those things from our diet. We're going to say no to fast food. I'm going to tell you like how a Filipino nurse told me while I was in training. Fast food equals a fast death. You want to increase your intake of colorful fruits and vegetables. Why? Research shows the more colorful fruits and vegetables you consume, you reduce your risk of developing cancers. Conversely, if you do not eat colorful fruits and vegetables, you increase your risk for developing cancers. All right? Reduce the consumption of sugary beverages. We talked about the harmful effects of sugar earlier. Reduce your use of salt, hypertension. As black people, we have a higher sensitivity to salt. All right? But why do we want to reduce or eliminate red meat and processed foods from our diet? And I'm going to say this, and this is not to be offensive, but more now than ever, your health is your responsibility. You could blame an MP all you want. You could blame a politician, a pastor, a doctor, a lawyer, whoever you want to blame. But at the end of the day, they ain't going to be there with you in the hospital. Your health is your responsibility. This year, the World Health Organization published a report about deli meats. And if we was talking about politics, you all would have seen it. But because we're talking about health, we ain't see it, because we ain't paying attention. But processed meats, including deli ham, has been classified as a Group 1 carcinogen. What is a carcinogen? A carcinogen is a cancer-causing agent. What is in Group 1? In Group 1, asbestos. In Group 1, gamma radiation. In Group 1, alcohol. We coming off the weekend. Who want to be brave to raise their hands to show me who had alcohol on the weekend? Keep the hand up. Keep the hand up. The World Health Organization in 2024 reaffirmed in 2025 and 2026 says no amount of alcohol is safe for human consumption. Alcohol causes 7 different types of cancer, including all that are wreaking havoc on this country. Okay. So we get deli meats. You see this? You see these meats, right? You know what places sell them and they fix it up really good for you and they could toast it or warm it and all of that. Don't call no name. Don't get me in trouble. I see the minister taking notes, so don't get me in trouble. But listen to what the research says. Approximately 2 slices per day increases a person's risk for colorectal cancer. Did you know that this is Colorectal Cancer Awareness Month? There is no clear, safe intake level of these things. We can't tell you eating 1 slice a week is safe, eating half a slice. We can't tell you what is safe with this stuff. And it's not because it's turkey or it's because whatever that is, but it's the way they process it. All of the chemicals and preservatives they put in these things make it unsafe. So, let's keep going. A lot of us know by now what healthy foods are. But let me tell us how smart we are. And I'm talking to myself because I don't want to get in trouble. So Nurse Chesmond Finley, let me tell you how smart Bahamians are. We take a healthy food. We say an apple a day keeps the doctor away, Nurse Finley. That's what we say. But then Nurse Finley can take the apple, cut it up, put it in a baggie with some of this salty Cajun seasoning, some hot sauce, and it don't make sense because that which is healthy is now unhealthy. And you put yourself on a path to come and see us. in an unfavorable circumstance. Exercise, because I finish it. We have to reimagine the way we see exercise. Exercise ought to be something that is enjoyable. I am not going to find enjoyment in exercising by myself. But if I take minister with me, if I take this young man with me, because these are my friends, these are my family members, we can talk, we can dialogue, and we're walking, we're exercising, and the time is passing us by and we don't feel it. Research says when you work out in groups, you are more likely to be successful. Keep your goals realistic. You cannot expect to lose 50 pounds in 1 month. Not even Ozempic could do that for you. When you exercise, you reduce your risk for heart disease, the number one thing that is killing us. You control and manage your weight. You increase your likelihood of living longer, healthier lives, and you keep this sharp. You see all this talk about dementia and Alzheimer's we get going on right now? This is my biggest thing. When last y'all been to the doctor? And not going to the doctor, ma'am, because you missed and cut your finger with the knife when you was cutting up them onions. Not going to the doctor because you missed and step on a nail. But when was the last time you had a full checkup? Do you know that there is something called NHI, where you can see a specialist physician for free? Even if you don't want to go to NHI because the government clinic is closer, do you know the majority of the physicians in the government clinics are specialty trained? Specialty trained. Because y'all are public servants, all of your blood works through the government system is free. Your registration is free. I have responsibility for a specialty men's health clinic. We do about $800 worth of blood works. That's what the private system would charge you. We do about $800 worth of blood works on our men for absolutely free. There is no more excuse. There is none. And I'm being honest and I'm being real with you. Because as you lay in that hospital bed, I clocking out after 4 p.m. I leaving you there. I'm not saying that to be funny, but I need us to understand this. Too many people are dying simply because they're not going to the doctor. That's it. 5 minutes to get your blood works done, maybe an hour or two in the public system, 30 minutes in the private sector, and you think that's too much for your life? At the end of the day, this is your responsibility. Some of you are working around chemicals. Even more reason for you to go. For women, this is what your annual physical should look like. Your mammogram, your pap smear, your colonoscopy, your blood works, your fertility and family planning, your hearing and your vision, your dental, and your mental health screening. A lot of times, your physicians may not tell you that they're doing a mental health screening. As we talk to you, we're assessing your mental health status. That is done through a simple conversation. But these are the things that you should expect to have done. All right? For men, this PSA is important. For God's sake, hear me today. This PSA is important. You're 40, you should have a PSA done at least once a year. Under NHI, that is free. Under our healthcare system in the male health clinic, that is free. You do not have to fear the digital rectal exam. We do not do the digital rectal exam anymore. Please understand that. Your colonoscopies, the same blood works and everything else as the women. So, here is my charge to you. Understand that today I am speaking to you because this is a free service provided by the Ministry of Health and Wellness. This service is often taken advantage of by private sector companies. It is taken advantage of by sometimes people who don't need it. There are people who need this service, know about this service, and don't take advantage of it. My charge to the leadership here today is do not allow this to be the last time you have a healthcare professional come in to speak to your grouping. My team and I, we go to BAIC every year. As a matter of fact, we will be there on Thursday because Thursday is World Kidney Day. We go to St. Augustine's College twice a year. We go to Kingsway twice a year. We go to the Defense Force. We go to many agencies to speak and promote healthcare. My simple charge is do not allow this to be the last time. That right there is my cell number. All it requires is a simple WhatsApp. I'm not Adventist, but I've been in so much Adventist churches, I feel Adventist. I can leave that there for 2 more minutes. Last thing. Like I said, Thursday is World Kidney Day. We will be having a webinar with Dr. LeVard Roberts. He is a triple board certified internal medicine specialist, hypertension specialist, and nephrologist. He will be speaking about the importance of kidney health. If you want to join, this webinar is free for you to join. All right? I'm going to leave it up on the screen as I turn over to Mrs. Pratt.